This is not the normal type of aircraft that you'd find out here.
We'll come into work at about 7 o'clock in the morning. We'll get a pass-down briefing with the off-going crew and see how their shift went, see what kind of missions they were on. We'll check a bunch of equipment. We'll issue ourselves drugs for the day and narcotics for the patients. Head out to the aircraft, make sure all of the aircraft systems are functional, all the medical systems are functional.
Right now there's 4 nurses and four medics and 4 pilots, and then we work on a 3-man crew, so there's always 3 people on base at the time. We're working on hire 4 extra nurses just because we're such a busy base, a high volume base, that they want to rotate us more often in between flights.
We'll receive a flight request from our comm center. The pilot will do a weather check and make sure that we can safely complete the transport and complete that flight.
Pilots will show up, shift change is 7 o'clock. We'll do kind of a pass down with the off-going pilot. Check the aircraft out, make sure everything's the way it's supposed to be. We'll review the logbook, make sure there's no open discrepancies, anything like that.
And we'll assemble the aircraft in about 10 minutes and try and be off the ground in about that same amount of time. And we'll head towards that patient.
It's basically an emergency room, just condensed to fit in the aircraft. So we can handle back-to-back probably 2 or 3 flights if we're just going down into El Paso. With the amount of medical equipment and stuff that they carry. So it's basically an emergency room. This is a Eurocopter EC-135. So it's a twin engine, light utility helicopter. We have a custom interior, of course, to do the medical stuff. I think each engine's about 750 horsepower, something like that. So a lot of power, pretty quick, pretty smooth.
We're specialized in critical care. So the majority of the patients we transport are very sick patients, whether it be traumatic injuries from like a motor vehicle accident or some kind of a rural assault or other trauma, and take care of a patient who maybe that hospital may be ill-equipped to take care of. So a high-risk medical patient or a high-risk obstetrics patient. They usually utilize our services for the sickest of the sick. People that can't survive the ambulance transport.
Our bread and butter run is going to be picking up here locally in Las Cruces, taking a patient down to El Paso. Sometimes we'll end up going up to Albuquerque, but the scene calls are different because you never really know what you're going to get into as far as where you're going to be landing, what the patient condition and stuff is going to be like. So it's everybody's kind of on their toes. You don't really know what you're going to get into until you're there.
So depending on diagnosis is depending on how we treat the patient. If it's a trauma, they're actively bleeding out, we're giving blood, we're stabilizing an airway. If it's neurology, they have a brain bleed, we're checking, make sure there's no deficits or they're not getting any worse, and just giving medication to try to bring down the pressure in the brain. So it all depends on what kind of patient we're transferring.
Normally when we come on shift, we're looking at about 3 flights a day. It's a normal pace for this space.
Our standard turnaround time is going to be around 2 hours. For instance, we'll fly from here over to a local hospital. It'll take the med crew about 30 minutes or so to what we call package the patient, get them hooked up to their medical equipment and all that stuff.
I think it's important because we're fast, and then we get to start the process in the route over there. It's not like, oh, we just scoop them, go. We actually have the tools. We have blood in the helicopter if they're bleeding out. We have medications that we could give to bring down pressures in the brain and stuff like that. So we start the care here, and then we get them the fastest possible to where they're going to get definitive care.
All of the clinical staff at Air Methods have at least 3 to 5 years of pre-hospital experience as a paramedic, or 3 to 5 years of ER and ICU experience as a nurse. And that gets you through the door to come on with the company. Then we receive hours upon hours of indoctrination, training, and ongoing education.
I believe it's about 2,000 hours that you have to have of flight time and experience built up before you can come into the air medical industry like this. Especially down here in southern New Mexico, this time of the year, our monsoon season can get kind of sketchy. When you're trying to make a weather call, it can be very difficult. Not quite sure where thunderstorms are going to end up, if there's going to be hail in it, or how severe they're going to be, if it's going to build up and blow up into something where you get stuck somewhere, can't actually transport the patient.
I think mindset's really important. I think the mindset that most of us develop is that we need to not focus on the injury, but focus on our ability to take care of it. I think we try and go through a meticulous process and a very regimented process of finding life-threatening injuries and fixing them in line with how we find them, and stabilizing the patient as best we can.
I think it's significant and important because we get people where they need to be in a timely manner.
It's actually very rewarding. I don't know if it's selfish or not, but it's a very rewarding job when you realize you've actually impacted somebody's life and made a difference for them, hopefully in a positive way.